How to know if you are consuming too many vitamins. Sometimes less is proverbially more, and that certainly applies to vitamins. Complementing your diet with a multivitamin or addressing a specific vitamin deficiency with a targeted supplement is perfectly okay, but sometimes the combination of vitamin enriched foods and vitamin supplements can be too much of a good thing. Some vitamins are relatively innocuous, even in high doses, but others are dangerous and even potentially lethal. How much is too much? The Institute of Medicine publishes recommended daily values for most nutrients, known collectively as dietary reference intakes. For most nutrients, the Institute lists a recommended daily allowance that meets most people's needs, an adequate intake that represents a best guess estimate of the minimum quantity required for health, and a tolerable upper intake limit that marks the highest levels of a nutrient that are still considered safe. You can determine whether your intake of a given vitamin is too high by comparing your daily consumption against the Institute's recommendations, by evaluating yourself for symptoms, or both. Fat soluble vitamins. Broadly speaking, vitamins break down into two categories: fat soluble and water soluble. Vitamins A, D, E, and K are fat soluble, which means they dissolve in fat and are stored in your body's tissues. While vitamins E and K are not known to cause any serious health issues, that's not the case with vitamins A and D. Vitamin A. The recommended intake for adult males is 900 micrograms or 700 micrograms for adult females. Too much vitamin A can cause dizziness, headaches, and nausea, and in extreme cases can result in a coma or death. Vitamin D. The recommended intake for most adults is 15 micrograms. Excess consumption can cause nausea and vomiting, constipation, loss of appetite and weight loss, or kidney damage. Water soluble vitamins. The remaining vitamins are water soluble, which means they dissolve in water. They circulate around your body, are used as needed, and eventually passed in your urine. Water soluble vitamins have traditionally been considered safe to consume in large doses because they're passed from the body relatively quickly, but that's not entirely true. A few water soluble vitamins can cause significant health issues. These include vitamin B6. Recommended intake is 1.3 milligrams for most adults, rising slightly after the age of 50. Excessive consumption can cause serious nerve damage, painful patches on the skin, and extreme sensitivity to light. Niacin. The recommended intake is 14 milligrams for adult females or 16 milligrams for adult males. Excessive intake can cause your blood sugars to spike and can lead to peptic ulcers or liver damage. Folate. The recommended intake is 400 micrograms for most adults, though pregnant women can minimize the risk of some birth defects by increasing to 600 micrograms. Excessive folate can impair the function of some medications, may cause certain cancers, and, most importantly, can mask a vitamin B12 deficiency, which, if undetected, can cause serious long term nerve damage. Diet versus supplements. It's very difficult to get too much of any vitamin purely through eating whole foods. You're more likely to experience accidental consumption if you both take a single vitamin or multivitamin supplement and consume vitamin enriched processed foods as well. If you're experiencing symptoms that might be caused by excess vitamin consumption, you should see your doctor immediately. If you're planning to add one or more supplements to your diet, you should consult with a doctor first.